Hello and welcome to my YouTube channel on pharmacology subjects. Today we learn about the topic drug acting on respiratory system, in which we learn the anti-asthmatic drugs. So before you start with the anti-asthmatic drugs, you must understand what do you mean by the bronchial asthma. So bronchial asthma, it is characterized by hyper responsiveness. Now what do you mean by the hyper responsiveness? There is a abnormal sensitivity to the external stimuli or the internal stimuli. So there is a abnormal sensitivity to the stimuli. It may be the external or it may be the internal to the tracheobronchial smooth muscle, means it is the trachea and the bronchial smooth muscles to a variety of stimuli. The stimuli may be a internal or may be the external, resulting in narrowing of air tubes. Now what in by narrowing of air tubes, there is a bronchoconstriction, it is occur and often accompanied by increased secretion, mucosal edema and the mucus plugging. Now what do you mean by the mucosal edema? Mucosal edema means there is a build-up of fluid, build-up of tissue fluid in that of the mucus. So there is a build-up of edema or the tissue fluid in the mucus, and this term it is called as the mucosal edema. And what do you mean by the mucosal plugging? So it is the airway filling by the mucosal secretion. If this airway it is filled by the this mucosal secretion, then it is called as the there is due to that it causes the plug. So the term it is called as the mucosal plugging. So understand. So what do you mean by hyperesthema or bronchial asthma? In the Marathi it is called as the dama. So you know that this is the general disease or disorder of your respiratory system, and there is a hyper responsiveness. म्हणजे एखादा काही आपल्याला जसं आपल्याला कफ झाल्यानंतर कसं किंवा ड्यू टू दॅट इट कॉजेस द हायपर रिस्पॉन्सिव्हनेस टू द एक्सटर्नल स्टिमुलाय. So it is the inflammatory disorder. You can clearly see that it is the inflammatory disease, and there is a reversible episode. Reversible means after sometimes it may be into that of the normal state. So it causes the bronchospasm, narrowing of air tube, mucosal edema and the mucosal plugging. So this is the diagrammatic representation of your respiratory system. This is the trachea, this is the lung, and this is bronchi and the bronchioles, and this is the alveoli. So in the alveoli you can clearly see that in the asthma patient, this is the titan muscle, and there is an increase in the mucus secretion it is occur as compared to the normal bronchioles. So this is the basic difference between the normal airway and the during asthma symptoms. So in the normal airway you can clearly see that this is the diagrammatic representation of your respiratory system. This is the your trachea, and this is the lungs, bronchi, bronchioles, and this is the alveoli. So in case of in the normal asthma, you can clearly see that air is passed or the oxygen is passed normally through that of the this tracheobronchial tract or the trachea or in the bronchioles. So this is the muscles and airway is not tightened, but you can clearly see that during the asthma attack what happens, there is a narrowed airway. So due to that there is a limited airflow. You can clearly see that this is the if there is this is the normal airway. Now what happen during the asthma, if there is a this thing is happen, so means there is a narrowing of your airway. So due to that airflow, there is a limited airflow. Okay, due to that there is a difficulty in the breathing. Your also these muscles get contract airway, and there is a tighten in the muscles, and also there is a thickened mucus because of there is a increase in mucus secretion from the goblet cell, and there is a thickest wake wall, thickened airway wall, and increase in the mucus production. So due to that it causes the difficulty in the breathings. Again you can clearly see that this is the normal airway during that of the now when during the asthmatic attack what happened, there is a inflamed airway, and there is an increase in the mucus secretion, and this muscle smooth muscle get tightened because of again it is of the bronchoconstriction, and there is a inflammation and increase in the mucus production it is occur, and hence it causes the difficulty in breathing, shortness of breathing, and the wheezing sound it is occur. there is a two types of asthma. There is a extrinsic asthma and a intrinsic asthma. Intrinsic asthma, so there is a extrinsic asthma means it is also called as the atopic asthma. Atopic asthma, it is called as the childhood onset, or it is the extrinsic asthma, and so this is called as the atopic asthma. It is called atopic because it is the genetic tendency to develop a allergic disease, so it is called as the atopic. The second one, it is called as the non-atopic asthma, or it is called as the intrinsic asthma, non-atopic asthma. So what is the basic difference between atopic or extrinsic, or in the, as the name suggests, extrinsic means it is the external factor, so extrinsic and intrinsic means it is the internal factor. So it is usually begun in the childhood and maybe in the early adulthood. There is a personal or family history of preceding allergy, so it is a genetic tendency to develop a allergic disease or the disorder. Hypersensitivity to the allergen, so it may be a dust or allergen or pollen grain or something which causes the hypersensitivity reaction. And there is a increase in the IgE level, so if you see that in the blood there is increase in the IgE level, and there is a positive skin test. Now done by positive skin test, if you get the dose of possible allergen, the high doses, high level of IgE makes you make the allergy, so it is called as the positive skin test. Now in case of the intrinsic, also it is called as the non-atopic asthma, and it is the adult onset or intrinsic asthma, or it is called as the non-IgE mediated asthma. So it is developed later in the adulthood, no family history, no recognizable allergen, there is a normal IgE level. So this is the basic difference between the extrinsic and the intrinsic asthma. And symptoms include the respiratory infection, emotional reaction, exercise, handling chemical, and the taking aspirin. So it is called as the aspirin sensitive asthma. So this is the intrinsic, due to that of the respiratory infection, emotional reaction, exercising, due to that of chemical if you inhale, it may causes the intrinsic asthma. So these are the symptoms of asthma. It include the cough. The cough may be it is mostly during the early morning or in the night. Breathlessness, there is a shortness of breath, or there is a difficulty in the breathing. Chest tightness and the wheezing. Now what by the wheezing? Wheezing, it is the abnormal whistling sound due to the difficulty in the difficulty in the respiration. It also, there is a bluish discoloration of the lips and face with nasal flaring, rapid pulse, sweating, and decreased level of consciousness. It is the severe symptoms of your bronchial asthma. So your asthma may be precipitate. The symptoms may be precipitate due to that of the cold air. So you can clearly see that in the winter seasons, the asthma patient may symptoms may be worsen, or it may be a precipitate. So in the case of the cold air, then if the person is taking the cigarette, then due to the cigarette smoking, because there is increase in the mucous secretion, airway pollutions, upper respiratory infection, emotional stress, and exercise may aggravate these symptoms. Now we'll move toward the pathophysiology of the asthma. It is divided into the two phase, immediate phase and the late phase. So in the immediate phase, there is a eliciting agent, which may be the allergen or the non-specific stimuli. The allergen, it is the substances which causes the allergy. So these are the substances, maybe your pollen grain, or maybe the dust, maybe the some particles or perfumes, some are allergic to that of the, and this allergen is bind to that of the mast cell. So this is the mast cell in which your allergen is bind as a antigen, and due to that it produces, it's the antibody. So antibody produced are the IgE. Antibodies produced are the IgE type of antibody, and it releases the various inflammatory mediator, and releases the, after that it releases the various inflammatory mediator such as the cysteine, leukotriene, histamine, and the prostaglandin type of it is the prostaglandin S2, which causes the bronchospasm, and also it causes the chemotaxins. We will see later. So after that, this is the pathophysiology of the bronchial asthma. Again, we already discussed the immediate phase. In the next step phase, it is the late phase. So again, we will revise what do you mean by the immediate phase. So eliciting agent or allerg or the non-specific stimulus, it stimulate the mast cell. So mast cell, it is the cell in which various inflammatory mediator are stored. Now what happens when allergen is bind with that of the mast cell, it releases the antibody. It called as the antigen antibody reaction, and it produces the antibody IgE, and due to that it releases the various inflammatory mediator. The inflammatory mediator are the cysteine, histamine and prostaglandin D2, which causes the bronchoconstriction, and hence you can see the symptoms. It is the bronchospasm, or it causes the bronchoconstriction. Next, after it also releases the it also causes the this chemotaxin or chemokinin. Now what do you mean by chemotaxin or chemokinin? The movement of organism in response to the chemical stimulus, it is called as the chemotaxis. But what do you mean by the chemotaxin? It is a substance. It may be your bacteria, or it may be your injured tissue, or it may be a white blood cell that stimulate the neutrophil. Means there is a stimulate the neutrophil toward the inflammatory side. Now you can clearly see that in the asthma, if there is inflammation is occur, so your neutrophil from the blood, blood vessel, it is attracted toward the this inflammatory side. So your neutrophil is attracted toward the where there is a inflammation, it is occur, and the term it is called as the chemotaxin. So your neutrophil get attracted toward the inflammatory side, or where there is a inflammation is occur. So simply you can clearly see that this is the blood vessels, and this where there is, if there is a inflammation is occur in the bronchial muscles or the bronchial in the lungs. So what happen? Your neutrophil is migrated toward that particular site. So this is called as the immediate phase. So immediate phase means it is the initial response to the allergen, and in the first phase it causes the bronchoconstriction. So it is the initial phase. So in that it causes the bronchospasm. Now we'll see the late phase. Now as the name suggests, late phase means it is the second phase or the delayed response, and other than the normal inflammatory cells, it also releases the eosinophil. So something important, it releases the eosinophil, and there is an infiltration of cytokine. Cyto means cell, and cytokine releasing Th2 cells. Now what do you mean by the Th? As the name suggests, Th means it is the T type of helper T cell. T means it is a T type of helper T cell. So it is a T type of helper T cells, and some monocytes, and activation of the your eosinophil. So there is a eosinophil is activated in the late phase, and again it releases the various inflammatory mediator such as the cysteine, which again it causes the neuropeptide, nitric oxide, adenosine, which act on the adenosine 1 receptor, and this is the specifically also it releases the various cytokine. So cytokine maybe it is the interleukin 3, interleukin 5. It is releases during the late phase of the your bronchial asthma. Now second important part, it releases the various toxic substances such as the EMBP. Now what do you mean by EMBP? It is the eosinophil major basic protein. Second one is the ECP, it is the eosinophil cationic protein, and third one it is called as the eosinophil derived neurotoxin. So these are called as the toxic protein. So EMBP, ECP and the eosinophil derived neurotoxin are called as the toxic protein. Now what is the role of this protein? Due to it is the toxic protein, it causes the epithelial damage. So it causes the epithelial damage, and due to that there is a loss of epithelium. So due to that it causes the loss of epithelial tissue, or there is a loss of epithelium. Understand? So you have to remember that it releases the mediator, but also it causes the release of various toxic substances such as the eosinophil major basic protein and eosinophil cationic protein, and due to that again it causes the this loss of epithelium, which this irritant receptor, the C fiber irritant stimuli, and due to that there is a airway hyperactivities occur due to the loss of epithelium. There is a airway hyperactivities occur, and hyperresponsiveness occur, and due to that again it causes the bronchospasm. So same, it is called the bronchospasm. Whistling means it is the whistling like sound or whistling sound due to the bronchoconstriction, and it is the coughing, and due to that there is an increase in the edema also. And this mediator also, it causes the airway inflammation, and both these causes the symptoms bronchospasm, wheezing, and the coughing. So this is all about the pathophysiology of the bronchial asthma. Now you can clearly understand what are the different target of drug action of the bronchial asthma. So you have to first target, it is the, you can use the mast cell stabilizer. Why? Because it mast cell stabilize the this mast cell and prevent the release of inflammatory mediator. So you can use the mast cell stabilizer drug such as the sodium chromoglycate. Understand? So it is the sodium chromoglycate, which is the mast cell stabilizer drug. You can, this is the first target from the site of drug action. Second, you can use the Ig antibody. So it is the monoclonal antibody. So it neutralizes the Ig called as the monoclonal antibody omalizumab. Then you can use the cysteine leukotriene antagonist, because this cysteine leukotriene act on the cysteine leukotriene receptor, and you can use the cysteine leukotriene antagonist such as the montelukast and the zapirlukast drugs. Then you can also use the antihistaminic drug, and some most important part, you can relieve this bronchospasm by using the bronchodilator drug. So by the target of drug action or through the pathophysiology, you can clearly learn that for the treatment of bronchial asthma you have to give the bronchodilator drug. So which type of bronchodilator drug you have to give? These are the three types. There is a beta 2 receptor agonist, which is a sympathomimetic. You can give the anticholinergic drug, or you can give the theophylline, which increases the cyclic AMP level. We will see the mechanism in the details, but you have to remember that these are the bronchodilator type of the drug. Or you can also use this cysteine leukotriene antagonist drugs. In the late phase, this is very important that if there is causes the inflammation, and to reduce the inflammation you can use the glucocorticoid. So glucocorticoid, it inhibit the phospholipase A2 and inhibit the various inflammatory mediator, and in the late phase you can use the glucocorticoid drugs. So for the, what are the different approaches for the prevention of treatment? So you have to first, what is the causes? Due to that of the allergens. So allergens may act as antigen. So you have to first prevent the antigen and antibody reaction. So you have to first avoid the antigen. So antigen may be the polar grain, or it may be a dust, mites, or anything which causes the allergic reaction, and due to that you can also use the hyposensitization. Hyposensitization means there is a prevention and reduction of immediate hypersensitivity reaction by administration of graded response of known antigen. So you have to give the antigen to that of the person, and you have to give the graded response, and you have to check the person, it is the sensitivity to that of the allergen. So if an antigen it is known, you can identify it by using the hyposensitization. Then you can use the neutralization of Ig. It is the omalizumab, which is the monoclonal antibody. As the name suggests, you can clearly see that mab means it is the monoclonal antibody. Okay, Li means it is the lowering the immunity. So in case of also there is a lowering the immunity, and umab and the zumab, you can clearly see that is the obtained from the human sources. There is suppression of inflammation and bronchial hyperactivity. So in the late phase you can use the glucocorticoid. So by the inhalation route you can use the glucocorticoid. Prevention and release of mast cell stabilizer. I have already told that mast cell is releases the various inflammatory radiator. So just stabilize. If antigen is bind, to stabilize this you can use for the prevention mast cell stabilizer drug. Then leukotriene receptor antagonist. You know that leukotriene, cysteine leukotriene, it is the various which cause, it is an inflammatory mediator which act on the its receptor, and which causes the bronchoconstriction. and hence you can use the leukotriene antagonist montelukast and zapilukast. Antihistamine you can, because histamine also releases from the mast cell, so prevent histamine act on the histamine receptor, and to prevent this you can use the its antagonist. Then platelet activating factor, so it is the platelet activating factor, it is derived from the phospholipids, and which is the potent endogenous mediator of the inflammation, and to prevent this you can use the this antagonist. Then blockage of constrictor neurotransmitter, so in case of the larger airway, there is a various important, it is the, there is a cholinergic tone, or it is called as the parasympathomimetic tone or the cholinergic tone, and this again it causes the bronchoconstriction. So to prevent the this constrictor neurotransmitter, you have to give the its antagonist, so you have to give the anticholinergic drug in the treatment of the bronchial asthma. Then mimicking means we use the similar action of the, or the dilator action of neurotransmitter. So this is a very important class are the sympathomimetic drug. You know that these are the mimetic, means these are the drug mimic the action similar to the stimulation of the sympathetic nervous system. So sympathomimetic drug act on the beta 2 receptor which is present in the smooth muscle, which increases the cyclic AMP level, and due to that it causes the bronchial smooth muscle relaxation, and this is a very important mechanism of action of your this bronchial asthma. Some drugs are the directly acting called as the methylxanthine. The methylxanthine, these are the drug which inhibit the phosphodiesterase enzyme and increases again the cyclic AMP level. So again, if you increase the cyclic AMP level, it causes the bronchodilation. So this is the very important. Before going into the directly into the drug, you must understand what are the different target of drug action of your bronchial asthma. So by using the pathophysiology you can clearly understand what are the different target of drug action. So to remember its classification or which drug can be used, so you must understand before the any pharmacology, you must understand pathophysiology of any disease. So by this diagrammatic representation you can clearly understand that you have to give the mast cell stabilizer, why you have to give the mast cell stabilizer, why you have to use the cysteine leukotriene antagonist drug, why you have to use the bronchodilator drug in the treatment of the bronchial asthma, because you have to stop that process of your bronchoconstriction, hence you have to use the bronchodilator drug. You have to stop the release of inflammatory mediator, hence you have to use the mast cell stabilizer. You have to stop the activity of Ig antibody, so you have to give the its monoclonal antibody. You have to stop the inflammation, hence you have to give the glucocorticoid drugs. So this is all about the first part of your bronchial asthma. So bronchial asthma, it is the respiratory disorder, and you have to remember its definition, what happened during the normal and asthmatic attack, type of asthma, it is the extrinsic and intrinsic, or it is also called as the atopic and non-atopic asthma. Important point you have to remember, it is there is a increased Ig level in the extrinsic asthma, and there is a no normal Ig level in the intrinsic asthma. So these are the symptoms of bronchial asthma, and this is a very important one, it is the pathophysiology of the bronchial asthma. If you understand this, you can clearly understand the target of drug action of the bronchial asthma. I hope all the students who learn pharmacology have understand this topic of the bronchial asthma. I hope we will continue in the next lecture. I request all, if you like my presentation or the top lecture, please like this YouTube channels and subscribe my YouTube channels. Thank you.